Population health is really the future of employee benefits from a cost and a quality and a management perspective. The longer-term way to manage benefit costs is to address people that have chronic and catastrophic conditions. About 10% of the people in the typical group health plan drive 90% of the cost. And so population health looks at the total population and the total health of a group to identify what are the right long-term strategies to better engage and to better manage that population with a focus not just on cost, but also on quality and outcome.
Guardian Nurses is a passion for me. I started the company in 2003 because as a nurse and as a member of a large family, I knew that patients needed help getting through the healthcare system. It became clear to me that we needed to help people sooner, that those 4-alarm fires that we were getting calls about, we might have been able to impact that journey if we had known sooner. So in 2010, I started to develop a model called the Mobile Care Coordinator model. And its intent was to be able to get to patients sooner.
The Guardian Nurses model, very different than the others, is about using nurses to personally engage with the patient and their family and help them build a care management plan, support them from start to finish, navigate them through this really complicated healthcare maze to get to the best outcome. We would see real human stories about a patient who had dealt with a terrible condition and because of the Guardian Nurse intervention, got to a better place of care, was more effectively managed, and we instinctively knew that that better quality resulted in a better outcome and resulted in a better cost.
We've always been asked, what's the ROI? What's the return on investment? And now, after having gone out to get an independent firm to look at the claims on one of our largest clients, we can now happily say that there is value to the work that we do. The report's conclusion showed that patients who were engaged with Guardian Nurses had 31% reduction in claims versus the patients who were not engaged with our nurses.
It demonstrated that for someone with a chronic condition, the savings is as much as 4 to 1. So for every dollar an employer or plan sponsor spends in the Guardian Nurses program, they save $4. For patients with an acute condition, the data reveals that the Guardian Nurse program saves $3 for every dollar an employer or a plan sponsor may spend on the program. These savings are outstanding.
We also had 0 readmissions in the patients who were engaged with our acute care nurse, which is extraordinary. You expect a certain percentage of people to go back to the hospital, but because, again, of our ability to engage patients and make sure they have everything they need at home, that's why there was no readmissions, which again is extraordinary. What makes Guardian Nurses so unique is that we are high touch and high impact. We know that healthcare is moving toward technology and more app-based solutions, but at the end of the day, healthcare is about humans. It's about establishing a trusting relationship with someone, and it's about calling them back or answering the phone when they have a question. Once they're engaged with a patient, they're working on acute issues, they're working on complex issues, getting them to a second opinion, they're working on family needs, right? They're wrapping their arms around their patient and their family to get them through the healthcare system.
I've been in this business for more than 30 years. I have yet to see a plan as effective as the Guardian Nurse program when it comes to having a sustained, long-term, contemporary approach to managing the health of a population. There's lots of options out there. I would tell you, I think the Guardian Nurse program is the best we have seen.
We're nurses. We help people. It's what we do. It's in our DNA.